and service members.
Okay. Senator Warnock of Georgia is recognized.
Thank you so very much, Mr. Chair. Under your leadership, the CFPB has done a lot to address the burden of medical debt that families fall into as a result of illness or unexpected trips to the emergency room. This issue matters because so many Americans are crushed under high health care costs, and they usually don't have a choice about whether or not they need that medical attention, whether it's in the budget or not. Sometimes you just need to go to the doctor. And this is particularly true for those who are living with diabetes, especially in a state like Georgia that sadly has not expanded Medicaid. And as a result, many of the counties in Georgia are a part of what I call in a recent report released by my office, Insulin Deserts. We released this bipartisan report earlier this month. There's some 813 counties all across our country with high rates of Americans who are uninsured and they have diabetes. And thus they are left unprotected from high insulin costs and particularly vulnerable to medical debt. In fact, in preparation for this hearing, my office found that 365 insulin deserts, nearly half, also have high rates of medical debt. So Director Chopra, what is the CFPB doing to address medical debt, particularly unfair medical debt collection and credit reporting practices? I know that we've already had some conversation about that today, but 813 insulin deserts or counties across our country, a lot of them in Georgia and all across the country. So these are folks who are dealing with a chronic disease, and we're seeing the impact of that on them both in terms of their health, but also financially. And so as you think about a disease like that, if you'd say a little bit more about your work addressing this issue.
Well, I think we've all been able to see some of the individuals. I recall one teenager who overheard his parents struggling financially because of his insulin expenses. I think he was 13, and he decided to self-ration because he was worried so much about his parents and their financial situation. In my past work, looked hard at the issue of potential price fixing by insulin providers. I think when we talk about medical debt, we also have to remember that this might ultimately lead people to not get care that they need to live. When a teenager is self-rationing insulin and then hospitalized, we know we have a system that is not working. And then on top of it, Senator, when I went to Georgia and met with, some of your constituents, one was Liz Coyle, talked about how medical debt is affecting people locally. And really, it is now the largest item of delinquency on credit reports. We have studied this exhaustively, and we are currently initiating the process to, and we may end up proposing that medical debt be ineligible for reporting on credit reports, given the unique dynamics and the widespread inaccuracies. I really hate to see that medical debt, especially when people are sick, being forced to pay even when they may not even owe, almost coerced to pay it, and we want to really address that.
Well, on the question of rationing that you raised with this particular 13-year-old, about 1 in 4 folks who are on insulin, 1 in 4 in our country, have reported that they've rationed their insulin at some point or another. And so I'm interested in exploring how Congress can work with CFPB to protect consumers, especially those with chronic illnesses, from medical debt. So thank you for your work. I think that as a start, we can pass my bipartisan bill that I put forward with Senator Kennedy and others to cap the cost of insulin for everybody. that would help prevent people with diabetes from going into medical debt in the first place. And I look forward to continuing to work with you on this important issue and exploring medical debt more in my subcommittee in Congress. Thank you very much.
Thank you, Senator.
Thank you, Senator Warnock, and thanks for your comments about medical debt. We've had a number of conversations privately